Good evening, everyone. My name is Brenda Alberg, Kenai Peninsula Borough Information Officer, and with me tonight is Dan Nelson, our incident commander, who is going to provide us an update. We've moved our broadcast to Wednesdays weekly, and he is joining us from Bear Creek Fire Station. Dan, where is Bear Creek Fire Station?
So Bear Creek Fire is here just outside of Seward, about milepost 5 of the Seward Highway outside of town. And, I was really fortunate to be able to be here today. And we had a small ceremony to mark the passing of the first Bear Creek fire chief. So I was able to participate in that and definitely want to recognize that and recognize their family and what they're going through. So I'm kind of a guest in their station today and stuck around here to do our broadcast. So thanks everybody for joining us on a new night. And I really just want to talk about a few things that we have here. And then, of course, you can ask your questions in the comment thread. So the Boroughs Incident Management Team, which is the group of people that manage emergency and disaster incidents within the Kenai Peninsula Borough, made up of borough employees as well as some outside help that we have, has scaled down to really just a minimal level as we've been monitoring the COVID-19 virus and working with our cities, our hospitals, and other stakeholders along with the state of Alaska. So for an update on COVID-19 today, it's been pretty steady. We have a total statewide cases of 355. On the Kenai Peninsula, 19 cases. So we have not had a new case reported in the Kenai Peninsula since April 17th. And of those 19 cases, 16 of those have been reported as recovered. On a statewide basis, of those 355 cases, 240 are reported right now as recovered. So obviously some good positive news. Those are definitely some good indications that what's been happening and what's precautions we've all been taking are certainly paying off. So as we are kind of just monitoring that, and the various cities in the borough are kind of in that monitor mode, we continue simply to work with those partners that I talked about before, make sure that the supply chain and some of those issues that are still hanging out are taken care of, with a lot of discussion that's really pivoted towards testing and some of the new technologies and the new availability of testing materials. So that's a brief update of what your borough is doing. Obviously things have calmed down a bit. We're in the governor's phase 1A with some of our businesses being able to reopen as of last Friday, with certainly some precautions. And I hope everybody had a chance to maybe pick up a meal or do something with some of those businesses as they were able to reopen. And we thank them, of course, for really the few that I've talked to and been in this week have been very careful about precautions and following those mandates and having masks available and sanitizing and just really all those things that are really contributing to the health of everybody. So that's our update from the borough. There's not a whole lot to say, but certainly we're in that mode of being able to be ready should something change and keeping an eye on everything with our partners.
Dan, let's talk a little bit about the guidelines for testing. I know that those changed a little bit. Can you share with us what that means here for folks on the peninsula?
As far as testing, there has been some changes to the guidelines, and this is certainly not the first change that we've had. But there's been obviously a lot of conversation around the subject of testing, which is a very important part of the state's strategy. And we've heard from the governor's administration, Dr. Zink, chief medical officer, that really the key to being able to do some of these phases for reopening and being able to do that safely all revolves around testing. So the state has released some updated guidance on for healthcare providers on testing and who can be tested and how we'll go about doing that. There's a couple different types of tests out there. So what I'm going to call the more traditional test, which is where you may get swabbed nasally and that sample gets sent off to be, I'm going to use the wrong words here, so I'm going to not get too technical, but are sent off to labs either in-state or private labs in the lower 48 that look for that test. There's also kind of the newer machines that some facilities have that have the higher throughput tests where they're able to get some answers back in relatively short order. So in either case, the turnaround time for testing has certainly diminished from what it was. Right now, the state of Alaska's guidelines say that anybody that has any type of symptoms should be tested or can be tested. You still want to go through your medical provider for that. So you're still going to call your physician or whomever you see for your medical needs, talk through your symptoms, and then get a referral to go to the appropriate place. And there's some more testing sites that have been set up, and some in hospitals, some in private clinics. That's managed by the state, and on our information hub, you can find those listed. If you do not have symptoms, so if you don't have any symptoms related to COVID, then there's still not testing being done. So in other words, we're not at a point here where we can handle everybody getting tested. And that's a combination of things, most likely having to do with supply chain and having those test kits and those test materials available. So still people that are asymptomatic or not showing symptoms are not being tested. Along that same vein, when we talk about people showing symptoms of COVID, the list of symptoms, we've all heard about, the cough and some of those types of things. Those classic symptoms have been expanded. So as people are, and I don't have those symptoms in front of me, so definitely not a comprehensive list, but when we talk about maybe the taste of, or a sense of taste or sense of smell, that loss, some of those types of symptoms are now eligible to go for that COVID testing. So long and short of it is I would suggest everybody can go to the Department of Health and Social Services website, which is linked on our website, kpboem.com, for a complete list of those symptoms and other information related to testing. But the take-home message there is still to contact your provider if you have symptoms. Remember to call ahead. Don't go in unless they instruct you. They'll go through some screening and be able to refer you to a test. But essentially, the procedure is still very similar, but there are now additional testing sites and kind of additional availability for tests. And that also includes some of our public health centers. So in Kenai and Homer, you can call for an appointment for the public health center and be able to get a test if you have that physician referral.
Thank you, Dan. I went ahead and put the link into the comment thread for folks, both kpboem.com, as well as the mapping that you had referenced regarding testing locations. One thing that I did want to remind folks that our public health nurses here in Homer, as well as in Kenai, have the ability to do the screening and testing here locally. Again, those are still considered referrals based on the symptoms that are now listed or have been updated. One of the questions that's also come up, I know that the governor talked a little bit about it today, was the antibody testing, and if that was going to be something available here in the state.
And antibody testing, I know they've been working on and looking at how to make that available and able to do some of those things. I know at this point, there isn't really a guideline or specific guidance for antibody testing from the state level. It's not something they've gotten to yet, but I'm sure that is something that is going to be coming out in the future and being a little bit more prevalent. And that's simply just kind of an inference with everything that's been said so far and how the data, that testing and that really quantitative data that we're looking for will help our health officials manage this and get everybody on the road to recovery and a little bit of normalcy that much quicker.
You're talking about normalcy and rolling out the phases of reopening responsibly, as been recommended by our governor. What is the borough's role as it relates to our municipalities, as it relates to the businesses, and how they are supposed to adhere to these mandates? Can you share a little bit about what we can and can't do as a borough?
Of course. So, the borough is designed with, by design and by voter action to have very limited powers. So we've talked a little bit about this on these broadcasts in the past, but, some of the main things that the borough does is, some of the core services that most people are familiar with: education, solid waste, our landfills, land use planning, those types of things. And then we also have service areas for things that certain communities may choose to vote in, and they choose to tax themselves through a mill levy for that service. And all of our fire service areas are that way, where they've been created over the years. And we have others like the recreation service areas, senior service areas, and such. So those powers between those general government powers and the service areas is kind of the borough's responsibility. What the borough does not have is any specific law enforcement power, nor does it have any health powers. So we as a borough really our main focus in some of these things, besides kind of the coordination and the emergency management side of things, is making sure that our public and business owners are informed of what resources are out there and making that easy to access. So the long and short answer to your question is that really we as a borough help get information out, such as these types of events, our website, our social media, and other things. But we don't have any direct role in telling a municipality, whether that's a city or whether that's a private business, that you may open, you may not open. Here are the stipulations. That all comes from the state. That comes from the governor's office. So sometimes people will ask us on here, certain questions, or perhaps, could I do this, or what about this? And, many times we don't answer those simply because that's not our role. We don't make those regulations. So we repeat and help with the information coming from the state. But that is really our boundary when it comes to, whether somebody can open or what we can do.
And even here in the central area, I've noticed we've had businesses who are making recommendations to wear a mask should you come into their facility, as they are also wearing masks. And then you have those who are mandated to do so based on what type of service they are providing, such as those in the whether it's you're getting your nails done or hair done. So depending on where you may be going, you may be asked to wear a mask for those simple reasons. So, but again, the borough is not enforcing those.
Yes, the borough doesn't enforce it, but I will take an opportunity, since we are on the subject of masks, that the state does recommend that people wear those masks out in public. And remember, if you are patronizing a private business and they ask you to do that, to please follow those directions. And they do have the ability to do that.
Now, speaking of masks, we've got Love Inc., who has been the clearinghouse, if you will, where they have been able to coordinate some on the Central Peninsula for gathering masks and also distributing them here in the local area. Is that something that folks can still contact Love Inc. to do?
Love Inc. is still acting as that good clearinghouse and kind of taking requests for masks, and also they've got a track on these groups that are making those masks, and whether that's members of the public or kind of these groups that have come together. So we know that there's people that have dropped off masks at specific locations and those types of things, which is wonderful. And of course, we thank everybody that's helped to make these masks and these face coverings. But Love Inc. is kind of that central repository. So you can contact them and request masks, or if you've got those things, and they can point you in the right direction. And I know there's many other groups doing that as well, and all are certainly useful, but they're kind of the ones that have stepped up to try and coordinate the bigger effort.
And their contact information is also on our blog at kpboem.com. I have pinned that location to the comment thread for folks if they need it. We have had a couple of comments here. Do you mind if we go to those comments?
Let's do it. We've got some time tonight.
Okay. So on here, we've had a comment from someone who wants to know, do you foresee the state mandates being changed anytime in the near future?
I wish I had a crystal ball sometimes in this business, but what I think I will say to that is, I think that they are continuously being reviewed at the state level, and I think that as soon as it's safe and prudent to do so, the governor will go and continue on with the phased approach that he has mentioned and made clear. So I would expect definitely some changes, but beyond that, I really can't say, which mandate or how that change would be made. We honestly wait and see and get that information at the same time everybody does. So we'll get it out there as soon as any changes are made, but I can't predict.
Certainly. And that also is a good reminder for folks to know that our efforts to date have been truly to slow the curve. It's very evident here on the peninsula, as far as I'm concerned, that we've had no new cases, knock on wood, and that everyone is doing their part, and we need to continue to do so. Another question that has come up is with regards to the regulations. Are we still in a position where if we travel outside and come back in, the quarantine regulation is, or excuse me, mandate is still in effect?
Yes, and so the mandate for quarantining, if you do come back from any sort of interstate travel, is in effect. So there is a form, I believe it's called a traveler's declaration form that you're to fill out, and that's going to do, ask for who you are and then where your quarantine location is. So as a reminder for folks, that mandate basically says that once you arrive in the state of Alaska via however you're doing that, whether that's airport or ferry or what have you, that you proceed immediately to your home or your hotel or your lodging, and you stay there for 14 days to help and continue to let us flatten that curve. That mandate is still in effect, so that needs to happen, and people should be visiting our website. I think we might have a link to it, or it's on the state website of that traveler's declaration form.
Yes, that is also on our blog on the right-hand column. The links are provided, as well as frequently asked questions regarding any of the mandates. That has also been updated for folks as well. Dan, I'm not seeing any more questions here in the comment thread. Lots of folks that are sure appreciate the fact that we're even staying with the weekly update. I wanted to convey that to you as well. So I'd like to ask if you've got some closing comments for tonight. We can wrap up folks' time for their valuable evening tonight.
Absolutely. So yeah, I'll wrap up here, and we'll see if anything else pops in here in the last moment or so. But we definitely appreciate folks that are joining us. We feel it's important, and there's definitely a good balance to be struck on maybe providing too much information or a little bit of overkill on COVID, as probably some people think. If you're watching the news and doing those things, I know sometimes I'd like to deal with something different in my professional world, but we appreciate everybody that's tuning in and continuing to really keep abreast of the information and taking those actions that have helped flatten the curve. You know what? When we look at things, 355 cases statewide. I think today, I'm searching my memory, I want to say we added 6 cases today in the entire state. That's a tremendous achievement for us. And, I'll again remind people that, it's not the time to stop doing these things. And things like the masks, things like if you're traveling from outside Alaska, isolating yourself for 14 days and helping to stop that. Remember that, everybody can potentially be a carrier. And so even when you're looking at things where, if I'm not in a high risk category, maybe I'm out in public and I'm feeling a little bit better at doing some of these things, any interaction you have with anybody that might be at a higher risk can certainly put them at risk. So like we've been saying all along, we're doing this for our friends and our neighbors and family and our community. So I encourage folks to keep doing that. We're going to continue to provide you updates. So even though we're not here on this live format, but once a week, we'll be here. Remember, every Wednesday night at 7. You can follow our social media, KPB Alerts on Facebook and Twitter, kpboem.com, and those things are updated as updates come through that are relevant and important. So, I will end this with a little bit of a tip here for folks, and that the weather has really gotten beautiful outside. I had to come over here to Seward. It was just a beautiful trip, and of course I haven't been out of town like many of you in several months. So it was a good thing to be able to come over here for a day and look at that. But I also passed by a couple fire danger signs, and we've been watching that fire danger, which is high or very high through most of the peninsula. So I will say, as thoughts kind of turn to the weekend and those household chores and those other things that I think many of us have been itching to get outside and do, please be fire wise and be careful with any burning. Remember here that on beginning May 1st, any burn permits you have are suspended statewide. So I just want to give people a little bit of a note on that, and just remember that it's going to be a little bit harder and a little bit more of a challenge for forestry to fight these fires through this COVID situation. So we appreciate everybody's help. That's about all I have, Brenda. I don't know, did anything else come into the comments before we wrap up?
We had one comment from an individual who says, what about if someone is traveling in an area that's within the state that has many COVID-19 cases? I'm assuming she's asking, should they not travel in those communities?
So the mandates on intrastate travel, that travel within the state, they are still valid. There has been some relaxing of that as it relates to outdoor recreation and some of those types of things. So certainly we are seeing some people travel more. I know I actually, when I was on the Sterling Highway and Seward Highway today, I was actually surprised how little traffic there was out for middle of the day, but certainly there was some. So there is no mandate that says you must isolate or not go through those communities if you're doing outdoor recreation or essential business or essential personal errands. But I think that is a real good one for us all to be safe as individuals to determine, how we do that. If we're wearing a mask, if we isolate when we come back from others or what have you. So the long and short of it is, I would certainly, if it's not critical, and it's not something that you can do with safe social distancing, such as being out of doors and hiking or doing some of those things, it's probably best to put off that travel at this point. But it is up for everybody to make that decision and to keep themselves and their community safe while they're doing so.
And I just also provided the information in our comment thread as well. I was listening, I promise. And with that, I'm going to say goodnight to everyone. Thank you so much for your time tonight, Dan.
And thank you, everybody, for joining us. We'll see you next Wednesday at 7 o'clock. Have a very great weekend, everybody. And we'll keep up with us on our website and our social media until then. Good night.